Welcome to new veteran orientation at the VA Pacific Islands Healthcare System. This presentation was created to provide information about the full range of healthcare services across the Pacific Islands, Guam, American Samoa, and Saipan. Please ask your PAC team to provide you with a patient handbook which aligns this presentation and will provide you with written resources to navigate our VA Pacific Islands healthcare system. We are a unique healthcare system. We only service veterans, and we would like to thank you for your service to this country. This presentation will provide an overview of the services and resources that the VA provides for newly enrolled veterans and their family members. If after viewing this video and you want more information about the services and resources the VA offers, please call the call center at 1-800-214-1306. The Veterans Health Education Coordinator at the Veterans Affairs Pacific Islands Healthcare System is located on Oahu. The coordinator is willing to answer any questions or concerns. You can contact the coordinator by phone at 808-433-0830. At the VA, we have a very unique mission, vision, and value statement. Our mission is to honor America's veterans by providing exceptional health care that improves their health and well-being. Our vision is to provide the best care and benefits to our veterans by providing exceptional services that are research-proven and patient-centered. Lastly, our value statement is I Care. I Care statement is an acronym and it stands for integrity, commitment, advocacy, respect, and excellence. I Care is more than just words. It affects how we interact with veterans and how it enhances the delivery of care. The goal is to make you a trusted partner and to provide quality of care. Please watch this brief video that shows how I Care is implemented. It is about a veteran who comes to the VA for the first time, and it shows an initial interaction between a veteran and a VA clinician.
This is ridiculous. I don't even know why I'm doing this.
This is it. It's the VA.
Look at this place. I don't even know where to start.
Hey, you gonna stay there all day? Come on.
Man, am I getting soft? Compared to some of these guys, I have nothing to complain about.
Check your body armor at the door, son. You won't need it here. Come on in.
Okay. The older vets are nice, but I'm sure the staff is going to be no different than the people
Thank you for waiting today, Corporal Ramirez. It looks like your appointment today is at the green team. If you take the elevator to your left, it'll be the 3rd floor. Thank you. Next, please.
Huh. College. One more thing I'll never...
It's a really good hotline, you know. It'll take all that GI Bill stuff and, I don't know, make it a lot less complicated than it seems. At least it did for me. My name's Tony. I was in the 1st Cavalry Division. I'm with the VSO. We're up on the 3rd floor. If you have any questions at all, you can come up and talk to us anytime. How long have you been back? 3 months. 3 months, welcome home.
Okay. So this is where all the smiles stop. Some shrink asks me if I've ever killed anyone. I bet they don't even know what an IED is.
I am so sorry. Hope you haven't been waiting long. We do a group with all our OEF vets on Fridays, and it's just so hard to stop once everybody gets into it. Especially when we start listing all the different kinds of IEDs. But before we start with all that, hello, I'm Dr. Shirley Cole. Welcome home, and thank you for your service, Corporal. Just so we can get to know each other a little bit, why don't you start by telling me a little bit about your MOS, your deployments, and how things have been going since you got back? What? Not what you expected?
You know what? It's not what I expected at all.
Well, you're not the first one to say that. I've heard a lot of guys say that.
This slide shows how the VA is divided into 3 pillars: benefits, healthcare, and cemetery. Benefits are non-healthcare items. You may be eligible for benefits like disability, compensation, pension, education, and training. Healthcare includes care from VA clinicians. The VA provides a number of healthcare services that include hospital, outpatient medical, dental, pharmacy, long-term care, rehabilitation, treatment related to military sexual trauma, readjustment, counseling, homelessness, and much more. The VA offers burial and memorial services to honor our nation's deceased veterans. The VA can honor a veteran by furnishing a headstone or marker at any cemetery, provide allowance to partially reimburse the burial and funeral costs, and provide an American flag to drape the casket of the veteran. The first division we are going to talk about is eligibility for healthcare benefits. To begin, you need to submit a VA Form 1010-EZ and a copy of DD-214. Once you have submitted the VA Form 1010-EZ at the nearest VA office or online, you will receive a letter either verifying you approved for healthcare or requesting more information from you. Once approved, you should receive a Veterans Health Benefits Handbook. You may be eligible for other VA benefits if you are a uniformed service member, veteran or spouse, child or parent of a deceased or disabled service member or veteran. Other benefits include compensation for a service-connected condition, education and training, life insurance, and home loans. A service-connected condition is an injury or illness that occurred during active duty time that can be traced to your current health condition. As a veteran, you can file a claim of your injury, and that claim will be evaluated and a decision made. Filing a claim can be done through several ways. One is through the eBenefits website. If you think you have a service-connected injury, you should talk with a Veteran Benefit Administration officer about filing a claim. Walk-in is also an option. The Honolulu Benefits Office is located on the first floor of the E Wing at Tripler Army Medical Center. We are open from 8 a.m. to 3 p.m. You can also talk to one of our National Service officers, such as Rafael Paris, at 808-433-0428. There are also other offices that provide benefit assistance, such as American Legion, Disabled American Vets, VFW, and Hawaii State Office Veteran Services. Please ask your PAC team for a copy of important veteran and family resources or call the call center at 1-800-214-1306. We are now going to talk about the healthcare services. The VA has switched to a new model of providing healthcare called PACT. PACT stands for Patient Aligned Care Team. A PACT is a partnership between you, the veteran, and your healthcare team to make sure you received whole person care. This is a personalized care to meet your individual healthcare goals. They meet often to talk to you about your progress toward achieving your healthcare goals. You are an important partner in this equation. The focus is on creating trusted relationships, which will affect all aspects of your healthcare. The VA switched to this model because studies have shown that patients who understand their health problems and how to self-manage them have better control, fewer complications, fewer emergency visits, few inpatient admissions, higher levels of satisfaction with their care and their clinicians, and higher levels of self-efficacy for coping with life challenges. The VA Pacific Islands healthcare system operates as an outpatient clinic and clinic hours. In Honolulu, we open from Monday through Friday from 8 a.m. to 4 p.m., with extended hours on Tuesday and Saturday. You can check with your community-based outpatient clinic and PAC team in your facility for hours. In your PAC team, they may include other members as well as pharmacists, social workers, health education, health promotion, and disease prevention. When making or changing an appointment, you can contact the call center at 1-800-214-1306. The call center is available 24 hours a day, 7 days a week, 365 days a year. Listen to the instruction and prompts. For example, press 1 for pharmacy, 2 for appointment, or 3 for telephone advice. When making appointments for VA Pacific Islands healthcare system, it is important to know that primary care and specialty clinics are not designed to be walk-in clinics. If you are having a medical issue or urgency matter, please call the call center and press 3 for telephone advice nurse. A nurse may schedule you for a short-term appointment or advise otherwise. Please continue to use 911 for all emergencies. Some examples may include chest pain, broken bone, and bright red bleeding. When preparing for your first visit at the VA, try to check in the kiosk a few minutes early. Please bring the following items to assist your VA provider. Examples include bottles of medication as well as non-prescription medication like over-the-counter, vitamins, or herbals. Along with your medication, remember to bring your latest lab results. This will help your provider personalize your healthcare visit by addressing your immediate care needs as well as any other items that may be important to you. Our goal is to have your VA doctor take exceptional care for you. To do this, we will need information from your outside community providers. Please provide any notes explaining what type of care is currently being provided, as well as medications and any information pertaining to changes in your health. Additional information such as copies of medical records and bringing a family member may be helpful. If you are diabetic, please bring diabetic glucose testing meter. The VA offers several types of healthcare services. Here is a list of services that the VA can help you with: inpatient, mental health, outpatient, and specialty. Although the VA is an outpatient clinic, the VA does partner with community providers for services related to stress recovery, rehabilitation, and other mental health services. The VA Pacific Islands healthcare system has long-term care facility and geriatrics on Oahu. This service is for veterans who have long-term stable conditions, including dementia, need rehab or short-term specialized care, or need comfort care at the end of life. The VA places high importance on offering mental health services to veterans of all ages from all times of war. Additionally, VA provides readjustment counseling to veterans and families across the nation. Now we would like to share a video about the importance of seeking care.
I don't know what it's like.
I don't know what it's like to be in a war.
I don't know what it's like
to be shot at.
to put my life
On the line.
I don't know what it's like. But I do know no one comes back the same.
No matter how tough you are,
How brave, how patriotic. Anybody can get hurt.
And not just physically hurt.
if you're a service member or in a military family and you're feeling hopeless,
You're not alone. Please call this number.
It's confidential and free.
your family needs you. We need you.
Thank you for your service.
Welcome home.
Factors that relate to military service may worsen with the emotional and mental health of veterans. Sometimes life is overwhelming and you may think about suicide. Approximately 22 veterans die from suicide every day. When emotional and mental issues reach a crisis point, it is time to call the Veterans Crisis Line. Each VA has a suicide prevention coordinator to make sure veterans have access to counseling and services. The VA wants vets to live a full and meaningful life and achieve their full potential. If you or a veteran you know who are showing signs, you can call the 1-800-273-8255 or text the number 838-255 or chat online at www.veteranscrisisline.net. All of these sources of information are designed to help contact the Veteran Crisis Line. It is free, confidential, and available 24/7. The VA offers prescription services to those who are eligible. Because medications and supplies are dispensed by the VA pharmacy, they must be ordered by your VA provider. If you are interested in getting your prescriptions through the VA, you are encouraged to talk to your VA provider. Pharmacy is one of the most popular services at the VA. As of February 27, 2017, the copay system for medications has changed to a tier system. Copays range from $5 to $11 per 30-day supply per medication, with a $700 annual cap. The range depends on the type of medication, whether it's generic or brand name, and if it is a preferred generic. Most prescriptions are mailed to your home. However, if you have to pick up your prescription at the pharmacy service may ask you to check in at the waiting area. Take a service ticket and wait for your number to be called. When your number is called, go up to the window and let pharmacy staff know that you are there to pick up your prescriptions. Once your prescriptions are filled by the VA and they have refills, you will be able to order refills several different ways. You can use the automated refill request line at 808-433-0050 or the number that is labeled on your prescription bottle. You can mail in refill slips with the provided address label or drop off the refill slip in the box outside of pharmacy. Or you can order online using My Healthy Vet's pharmacy feature. When refilling your prescriptions, please allow at least 14 days before you run out of medication. This will allow time to have your prescriptions to be mailed to you since most prescriptions are mailed to your home from the VA pharmacies on the mainland. Make sure that the VA has your correct mailing address. Your prescriptions will be mailed to the address that the VA has on record and not by the address in your My Healthy Vet account. Please do not call your PAC team for refills. You can use a call center and press 1 for pharmacy, then press 1 again to use the automated refill system, or press 1, then 2 to speak to the pharmacy staff. For Neighbor Islands, please call the Neighbor Island refill line at 1-800-465-8387. If you currently fill your prescriptions outside the VA and you want to get them filled at the VA, let your VA doctor know. You will most likely need to bring a prescription from your outside doctor, so your VA doctor will know exactly what you are taking. The VA works with a formulary, a list of medications that the VA covers. If you are currently taking a medication that is not on the VA formulary, your VA doctor may need to replace it with a similar medication that is on the VA formulary list, or your VA doctor can fill out a non-formulary drug request if he or she feels that you need to continue on your current medication. The non-formulary drug request is reviewed by the pharmacy. If approved, the VA will provide that medication to you. If you are subject to a copay, your copay for that medication will be determined through the copay tier system. Getting care after hours and emergency care. You can use the telephone advice line to talk about your medical concerns. The nurse will work with you to get the care that you need. The advice line may advise you to go to the emergency room. If you are having a medical emergency, please call 911. If you go to a community emergency room or stay in the hospital and have questions about your VA coverage, you should call the non-VA care number within 72 hours of your visit to the emergency room and leave a message with your name, the last 4 numbers of your social security number, the hospital you attended, and the date. It is important that you are using VA care. Please bring your VA ID with you when you go to the hospital or emergency room, and also let them know that you are a VA patient. The VA uses technology to access health care. My Healthy Vet is VA's online health record. It is a free program that allows access to parts of your VA health records. It also has features that allows you to request prescription refills online and to communicate with your VA healthcare team. Now we would like to show you a video about the benefits of using this program.
Isn't it funny how sometimes the most important things in your life can often feel like the most daunting? Consider your healthcare. Appointments, prescriptions, reports, and results. With so many things to remember, it can be hard to organize it all. So don't. Let the Department of Veterans Affairs help you put it all together in one place. Go to myhealth.va.gov, an online personal health record designed for veterans, service members, and caregivers, putting you in control of your health needs. It's easy and it's free. At My Healthy Vet, you can safely and securely view VA lab results, log and track vital signs, get wellness reminders, view your VA appointments, and fill VA prescriptions without ever leaving your home or waiting on hold. Simply opt in to secure messaging at My Healthy Vet to easily communicate with your VA healthcare team. Not sure where to go for care? No problem. You can find that on My Healthy Vet too. And with all of this information at your fingertips, you can become a more active partner in your healthcare. Have questions? By opting in to secure messaging with My Healthy Vet, you can ask your VA healthcare team almost anything at your convenience. Now, that's technology and VA working for you. And with the VA Blue button on My Healthy Vet, you can download your personal health data into one single file to save, store, and share with your family, caregivers, or non-VA providers. So what are you waiting for? Secure messaging with My Healthy Vet ensures the best healthcare experience for today's veteran patient, all with the touch of a button. Let My Healthy Vet put your treatment well-being in your hands. Opt in to secure messaging today. My Healthy Vet. See your personal health records, share your health information, and learn how to be a better partner with your healthcare teams 24/7. Don't delay. Do it today.
What you will need to do first is to register for My Healthy Vet. In order to be able to use all the features you saw in the video, you will need to become a premium account holder. You can do this by completing a one-page in-person authentication form. This will authorize the VA to release personal and protected information to you through your My Healthy Vet account. With your premium account, you will be able to download parts of your VA medical results to print and to give to your non-VA providers if needed. You can also view tests and lab results you do at the VA, secure messaging with your VA healthcare team, and much more. Secure messaging is a great alternative to using the telephone to contact your VA healthcare team. VELR is a national program that allows VA and non-VA providers to exchange and see your electronic medical record. This way, providers are able to make more informed decisions about your care and provide immediate access to additional healthcare information during an emergency. Veeler is completely secure, voluntary, and free. Veeler benefits you by reducing the need to carry paper records between healthcare providers, helps lessens the repeat of lab tests, and provides past surgery by giving your healthcare team the ability to better meet your needs. Currently, we have Hawaii Pacific Health and Kaiser Permanente as local partners that are participating in the Veeler program. Each veteran should have a single assigned primary care provider who oversees all aspects of care. However, the VA will assign you to a PAC team that will manage all areas of your VA medical care. Dual care occurs when you see both a VA provider and a non-VA community provider. It is important that you provide copies of treatment plans and medication orders from your non-VA provider to your VA doctors and vice versa. This will enable providers to develop the best plan of care for you. All Hawaii veterans enrolled in the VA healthcare system will receive a Veterans Choice Program care in the mail. The Veterans Choice Program is a temporary program that allows you to receive health care within your community. The Choice Program does not impact your existing VA health care or any other VA benefit. Care in the community is not only covered by the VA for medical needs. The VA can schedule an appointment for other medical needs, but will only cover the costs of care related to your VA-approved health needs. If you need more information about the Veterans Choice Program, visit the website at www.va.gov/opa.choiceact or call 1-866-606-8198. If you need a copy of your medical records, you can request a copy of your medical record through the Release of Information Office or your PAC team. Some veterans would like to access their military medical records. You are able to search for military records through the National Military Personnel Records, St. Louis Archives. You can either call them at 1-866-272-6272 or go on their website at www.archives.gov. VA Telehealth Services uses health informatics, disease management, telehealth technologies, and case management to target care and to improve access to care. Telehealth helps ensure that veterans get the right care at the right place and at the right time. Telehealth involves the health information and telecommunication technology to provide medical care to patients when they are geographically separated from their provider. You may be in your home, somewhere in your local community, or your workplace. The types of telehealth services that the VA provides is clinical video telehealth, store and forward telehealth, and home telehealth. Check with your PAC team to see which one of these programs is the right one for you. Services include mental health, nutrition, endocrinology, and more. Women are the fastest growing population within the veteran population. The VA has Women's Health Services Clinic and wants to meet the needs of women by providing them with the best care in a safe and healing environment. The Women's Health Service provides comprehensive primary care. It also provides routine gynecological care like mammograms, cervical cancer screenings, vaccinations, ultrasounds, birth control, and more. Along with those two services, they also cover diagnosis of certain conditions and maternity care. Women veterans will also have access to reproductive health care from the same doctor at the same place and when possible at the same visit. Maternity care and newborn care may also be provided to eligible women veterans. The mission of the prosthetic and sensory aid services is to provide comprehensive support to optimize health and independence of the veteran. Our vision is to be the premier source of prosthetic and ortho services, sensory aids, medical equipment, and support services for veterans. If you are eligible, you can request the items through your PAC team. Patient Advocate Program was created to ensure that veterans are able to communicate their concerns and compliments about the care they receive in a timely manner. If you are having difficulty resolving a healthcare issue, please contact your PAC team to see if they can resolve your concerns. If you need further assistance, you can contact Patient Advocate at 808-433-0126 or 808-433-0257. Operations Enduring Freedom, Iraqi Freedom, and New Dawn Transition Support Program is to help veterans who served in combat since November 11, 1998, in their transition to civilian life. Combat veterans who served post 9/11 are eligible for 5 years of cost-free health care for any condition related to their service in the Iraq-Afghanistan theater and 180 days of dental benefits. They are a one-stop shop for information and assistance. This program provides advocacy for veterans facing quality and access issues while pursuing Department of Veterans Affairs healthcare and benefits. They also provide care management services to OEF, OIF, OND veterans that require different levels of care. The Vet Center offers counseling to combat veterans and their families. The Vet Center has 2 locations on Oahu, one in Honolulu and one in West Oahu, and 1 location for each of the CBOC. Check with your local vet center for location and times. The vet centers are community-based offices and their services are free and strictly confidential. Vet centers welcome home war veterans with honor by providing quality readjustment counseling in a caring manner. The VA will have no access to any information that they have. The VA has a new mobile app available called Veteran Appointment Request. If you are already assigned a primary care provider, you can use this app to schedule your own primary care appointments or request for a primary care appointment. If you are already assigned a mental health provider, you can use the VAR app to request a mental health appointment. If you would like to use this app, go to the VA App Store at mobile.va.gov/app store to load the VAR app. There is no charge to load or to use this app. The Veteran Affairs Pacific Islands Healthcare System offers several education classes for veterans. The VA has a weight management program for veterans called MOVE. Other classes include diabetes education, quitting tobacco, high blood pressure, and living with chronic pain. These health education classes and groups are available to you to help you live a healthier life. Please contact your PAC team or call the call center for more information. If you want more information on health education, you can go to the links provided. Today, veterans and families have over 1,000 phone numbers to navigate and connect to the right place. The overwhelming amount of numbers can sometimes leave veterans confused and frustrated when attempting to reach VA for information about their benefits and services. Veterans have mentioned that they want only one number to help get their answers more quickly. The launch of MyVA 311 is part of a larger effort to provide positive experience for veterans connected to the VA. The number for this is 1-844-687-2311. If you have any questions or concerns, please contact your PAC team or the call center. Thank you and welcome to the VA Pacific Islands Healthcare System.